Their first match since lockdown, and for the odd moment, it's as if nothing's changed. But it has. At Darwen Cricket Club, they've waited all summer for this. But they're also waiting for what happens next, in an area where the number of cases of COVID-19 remains stubbornly and worryingly high.
I'm not worried in terms of catching it, but I am worried that it might lead to further lockdown restrictions. Yeah, very worried that we might have been waiting all this time. Finally we get cricket and it might just go just like that. So yeah, I'm worried.
Yeah, it's frustrating as well, because like you say, getting back to do this and then in saying a week's time or 2 weeks' time, we get the message saying, oh, you know, we are being locked down. We can't play again. It's just going to be annoying and frustrating.
In life, everything comes with risks.
You got that? Oh, whose car? Lovely.
Unlocking means balancing the risks. And with the Prime Minister all but ruling out another national lockdown, likening it to a nuclear deterrent, a threat that's maintained but not used. The same can't be said for more local lockdowns. In Blackburn, people are being told to wear a face covering to avoid another lockdown. In reality, it takes more than that alone. And while Boris Johnson insists the national test and trace system is as good as any in the world, the data suggests otherwise. National traces reached just 55% of people identified as contacts, according to the most recent figures. In Blackburn and Darwen, it's thought to be even lower, less than half.
We're just asking one person out of a group to fill these in for the track and trace. We keep them for 21 days.
So while businesses, like this bar in Blackburn, take down the details of everyone who comes in, a list of names and numbers doesn't achieve much, unless the system works and the virus is tracked and transmission stopped.
If we don't follow the guidelines, and we actually go into another full lockdown in Blackburn Town Centre, 70% of small businesses will shut. So when they announced Leicester going into lockdown, and then Blackburn got to the top, within the top 10, then yeah, I think it scared a lot of people into not coming back into the town centre.
I think now, if you are not going to do what your council or your government say, and I know there's been mistakes and everything's been up in the air through it, but if you're not going to do that, what about those people who missed out? What about those people who had to watch their family funerals on cameras? And I think if you don't do it, then it's selfish, isn't it?
The Department of Health has told us test and trace is helping control the spread of COVID-19, and the national system is working with local teams. If there are to be more local lockdowns, then some places have even more at stake than others.
Well, I've been speaking to the Mayor of Greater Manchester, Andy Burnham. He's been pushing to get access to named patient data, and I began by asking him why he believes the national test and trace system is not enough.
Yes, well, there's a couple of things here. The testing data does need to come every day. And at the moment, it's only coming weekly or sporadically. So then alongside that, you have this national contact tracing system. And there's a report in the papers today that says in the northwest of England, it's only reaching 52% of people testing positive for the virus. Now, that is nowhere near where it needs to be. It needs to be at least 80% if we are to successfully get a grip on this virus. So the Health Secretary really needs to order an urgent inquiry into why levels of successful contact tracing are so low in the northwest, and action has to be taken because we're heading towards a winter here without a vaccine, and we cannot have gaping holes in the contact tracing system across the northwest.
Are there big risks here, though, of stigmatising certain communities? I mean, if we look at the towns involved, Blackburn, Nelson, Rochdale, they're all places with sort of high working-class Asian communities, and they're probably involved in this to a large degree.
Well, I really hope we're not going to see that, because these communities certainly should not be blamed. It's a factor, I think, of overcrowded housing, poor quality housing in many of these communities, but also the nature of people's work, because many people in those communities know that if they get a phone call from the test and trace system asking them to self-isolate for 14 days, They know they can't do it because they won't be paid. And I think this is one of the big reasons why there is a low return to the national system from some of these communities. And actually, what I would say to the government, this is another gaping hole in the system that needs to be fixed. Companies have had a lot of support from the government over recent months. I don't think it's too much to ask that those companies let all employees take 2 weeks off so that we can all get a grip on this virus.
When it comes to the idea of a second national lockdown, perhaps at Christmas, we now have the chief scientific advisor saying it's perfectly possible that that's needed, but the Prime Minister comparing that to detonating a nuclear bomb. You know, so where does that leave you expecting, you know, the likelihood of national action?
Well, it does leave me wondering. It feels a little bit like, oh, now it's all over to you, councils, and you sort it out. You know, we haven't given you the money. We haven't made up the hole in your balance sheet. We're only just giving you the data now. It does feel a little bit like that. I would say you can't possibly rule out that we might need a second national lockdown because we honestly don't know what the winter holds. And every possible response should be on the table to protect people as we go into the second half of this year. And actually, to be honest, none of this is about politics. It's frustrating at times to have to kind of shout towards the government to get some of these things fixed. What we need to get back to here is a proper partnership, national, local, working together to ensure that we've got the strongest possible defences against this virus.
Andy Burnham, thanks very much.
Thank you very much.